A Call 6 investigation is prompting state lawmakers to take action. The Indiana State Department of Health will not release where people are dying in nursing home or where the outbreaks of COVID-19 are happening. WRTV filed a formal complaint to get those records, but the state says it doesn't have them. Call 6 investigates. Kara Kenny joining us with the action now underway to change that.
A group of Senate Democrats on the Health Committee wrote this letter to the governor criticizing the state's decision not to gather and publish nursing home data broken down by facility. They say the public deserves to know where people are dying in Indiana nursing homes and where the outbreaks are happening. Nearly half of Indiana's COVID-19 deaths are in long-term care facilities. Many lawmakers are hearing from their constituents who want information at their fingertips, but simply can't find it.
And she's trying to find a place to put her dad. And she says, you know, I want to put him in the best home possible, but I don't know because there's no information.
In a letter to the governor, Senators Jean Breaux, Eddie Melton, and Frank Mervan called on the governor and the State Department of Health to collect and make public nursing home COVID-19 data broken down by facility. It's information Call 6 Investigates has been fighting for since mid-April. The state told us ISDH does not have the records requested, and by law, they don't have to make one.
I wanted to thank you for putting the spotlight on this because, again, this is an area where many folks are concerned. And so you're just bringing to the forefront what a lot of families and individuals are feeling but don't have a voice.
Nursing homes are largely funded with taxpayer dollars through Medicaid and Medicare. Senator Melton points out as the state gets more federal funds to help with COVID, they could use this nursing home data.
We have to make sure all of these resources are allocated at the appropriate locations in the communities and facilities that are most impacted.
Lawmakers also question how the state can track and publish COVID by zip code and other demographics, but not by nursing home facility.
I'm not sure where this disconnection is coming from.
We spoke with members of the Indiana House who agree.
That's absurd, I think, in this day and age when we can track everything with data and we can have those numbers updated. We should be able to do that for our citizens.
We talked with 4 lawmakers who say a bill is needed.
We could definitely put in legislation that the state have to release the names of those facilities whenever there is a pandemic, any information that they're getting. But that won't occur to January. Once we get into session and then try to do an emergency bill, that still won't take place to January.
That's why lawmakers are urging the governor and the State Department of Health to take action now and make nursing home data available to the public. We reached out to every Republican member on the House and Senate health committees, but no one got back to us on a request for an interview or statement. Reporting at the State House, Kara Kenny, WRTV.
Well, we reached out to the governor's office for its response to the letter. We're still waiting to hear back. The State Department of Health releases only weekly aggregate totals, and those numbers will be released on Monday.